We're recording.
Okay. All right. So welcome, everyone. My name is Melissa Harvey. I'm the Vice President of Community-Based Programs here at Gemma Services. Welcome to our Family Support Program Open House. So a little agenda for today. First, we're just going to give you a little bit of a Gemma overview of the programs that we have here. We are also going to talk about our family checkup model, which is part of our family support program. We're going to talk about in that model how it supports families, give you a timeline, talk about a little bit of the referral process, review our community connections, and allow time for discussion and Q&A. So just wanted to give an overview just about Gemma Services in general, because some people may or may not be familiar. So Gemma Services was formed by a merger in 2019 by two similar organizations. Some of you may have heard of them, Silver Springs Martin Luther School, and then The Village. And so these are two like-minded organizations, both faith-based organizations that then formed a partnership, a merger in 2019. We have three campuses or locations. At our Plymouth Meeting campus, we have our residential treatment facility and our approved private school. And then for our community-based programs, we have a Southwest Philadelphia office, also called the Preheim Center, and then our Mount Airy location, which is on Germantown Avenue. A lot of our community-based programs just occur in the community. So we're working with families in their homes, in their schools, at daycare centers, at rec centers, all over the place. But some of the services that we do provide are housed within the offices. So here's just a general overview of just kind of the structure of Gemma Services. We just thought this would be helpful to just kind of set some context. So we have kind of three arms of programming and services within Gemma. So we have our psychiatric residential treatment facility, which I indicated before is at our Plymouth Meeting site. We also have an approved private school, also at Plymouth Meeting. And then our community-based programs is our third kind of arm. And within that arm are then three sub-arms under that. So we have our behavioral health programs, which include outpatient services, intensive behavioral health or IBHS. We also have family-based programs. Then we have child welfare services, which include treatment, foster care, and adoption. And then our prevention programs, which are our Family Empowerment Center, our in-home protective services, and our family support program, which is what we're going to talk more about today. So I'm now going to pass it off to our fabulous director, Valerie Colquitt-Wright, who is new to Gemma Services, who is the director of the family support program, and she's going to share with you more about what the program involves.
Thanks, Melissa, for the introduction. Good afternoon, all. I'm glad you could join us for our open house, and we are so excited that Gemma Services is launching a new free voluntary home visiting program called Family Support Program, and it's in Philadelphia for families with children ages through 5 years of age. The program is designed to help support families meet their own goals and help build on family strengths. With the family checkup, families will experience less conflict in the home, improve connections with their child, reduce feelings of stress and depression, emotional and behavioral improvements for their children. There's over 30 years of research supporting the family checkup model. It's an evidence practice. It also helps families with, again, children's ages 0 to 17. We're happy to link you to the research if you are interested in hearing more about the positive experiences, both short and long-term outcomes after going through the family checkup. The three things that really kind of drew us to the family checkup was that, again, their families experience less conflict in their home, they connect with their children more, and they have a better feel about what is going on in their home, and overall feel less stressful. The children experience improved emotional regulation and have behavioral improvement. And then the caregivers also experience less stress and depression. The overview of the program is that we received a grant from OCDEL, which is the Office of Child Development and Early Learning, through the Commonwealth of Pennsylvania. It's a community-based home visiting program at no cost to families. It also helps families access supports and services that promote the well-being of the families and their children. It helps parents or caregivers enhance skills and resolve problems to promote optimal child development. And it also increases the confidence of the caregivers. Who can participate in this program? Any family that reside in Philadelphia, families with at least one child aged 2 through 5 years, families that want to work with a family support partner for at least 3 to 15 sessions. Families can be involved in other services at the same time, and interventions are focused on the family or the caregiver. What makes the family checkup program unique? For one, it's evidence-based. It's an evidence-based home visiting model. It's also a family-driven process. It includes immediate feedback and recommendations. There is an average of about 8 sessions per family. It's assessment-driven and strengths-based. And families stay open with the program from at least 3 weeks to 6 months. The core elements of the family support program, it's strengthening families. And that's really important. It utilizes reflective supervision and motivational interviewing. There's a family checkup, an everyday parenting. Also, there's a peer support partner, as well as a family resource fund. The program flow, there's a family checkup, there's everyday parenting, and then there's transitional planning. I'm sorry, can you go back a slide? Yeah, the family checkup includes a comprehensive assessment and strengths inventory that can lead to a parenting curriculum called the everyday parenting, and subsequent transition planning that includes referrals and community resources or connections. Okay, the family checkup has 3 components. One, initial interview, and that's where the family support partner gets to learn the family, get more information on the family, build rapport with the families, encourage and motivate them to participate in the second component, which is the comprehensive assessment. And in the comprehensive assessment, there's a 3-session assessment that uses a 20-minute structured tool, which is questionnaires. And there's a parent-child interaction video recording. And then the third component is there's the feedback session, which is a tailored feedback session that involves the provider and the parent collaborating together, setting goals for follow-up services, such as the everyday parenting. Through the family, well, this is the conceptual framework for the everyday parenting curriculum and the family checkup. Through the family checkup, if it is found that the family needs the everyday parenting, which is a mindful parenting, proactive perspective, there are 3 components in the everyday parenting program, which there's the positive behavior support, then there's setting healthy limits, and then family relationship building. And the everyday parenting is a research-based family management support program. It can be tailored to a family's needs and targets the 3 primary parenting domains, which I mentioned here: the positive behavior support, setting healthy limits, and family relationship building. The transition planning identifies needs for the community connections. It provides specific information for next steps for the family. It support and encourage parents in the next steps. It support in obtaining application or referrals for community connections. And if in fact the family need early intervention for the children, we will connect to the early intervention, and also connection to educational programming. The transition planning process will help families with specific steps to meet the needs that are identified in the feedback session. This is our staff currently. I'm the director. We have Talia Hall, which is the supervisor, Aisha Jamal, which is one of the family support partners, and Kahira Smith. We have 4 of a 10-person team. We're still in the process of hiring a team, but these are the 4 that's on board right now. There should be 5 family support partners. We'll have the intake specialist, a QA specialist, and a peer support specialist. When will the service start? We're doing community outreach now. We'll start accepting families in December, and we'll continue to add capacity in the early, like January, February, and forward. We've been working on developing relationships with other community services, and we'll start receiving referrals pretty much next week. As we grow our staff, we will continue to expand our capacity to provide services. How to make a referral. Here you see the information here for family support at gemmaservices.org, gemmaservices.org community/prevention. And here's the phone number here, 215-730-2240. The website has a form that asks for information about the family and how to contact them. It takes approximately 5 minutes to complete. Community connections, which is building collaborative relationships to support families, building referral network of supports, and connecting families to early intervention and Head Start. We're looking forward to building partnerships with you and want to build community connections to help support the families in Philadelphia. So here's where we have our discussion. I'd like to thank you all for coming out and joining us today, and we welcome any questions and conversation.
So what questions does anyone have?
Oh, so the PowerPoint was clear, I guess. No questions?
It would be December 1st or anytime after December 1st, you're going to take referrals.
We'll probably start taking referrals next week, as early as next week, December 5th, Monday.
Valerie and Melissa, I thought it was really clear. It was wonderful to learn more about it. It sounds fabulous. I love your team who's on board. So I have to hop off, but I wanted to say it was awesome and thank you very much. And I look forward to hearing more about it.
Thank you.
There's a question in the chat, which is a good question. Can this program accommodate telehealth?
No, unfortunately, we're basically a home visiting program where we go into the homes. If a family is not able to accommodate us in the home, we can do it at the agency or at a church or another location in the community, but it's not a telehealth program. Any other questions?
Kate, I'm trying to put the brochure and the PowerPoint in the chat, and I'm having some difficulty. I don't know if you might be able to pop that in the chat as well.
Yep, I'll put it in.
Thank you. And we also have our brochure in Spanish. We can accommodate other languages. I did want to point that out. So we will provide translation services if that's something that a family needs. I know another question comes up whether this service can overlap with other services. So I know we talked about it in the PowerPoint, but I just wanted to reiterate that because a lot of the programs in Philadelphia, they require, if it's regulated by a certain managed care organization, there's very strict requirements about, not allowing services to overlap. So this allows a lot of flexibility. We can overlap. So if a child is maybe getting outpatient therapy, but there's a younger child in the home, we can certainly provide that too. If there's family-based services, also can provide that. IBHS services can overlap. So I just wanted to reiterate that. Thank you, Kate. You're putting everything in the chat. We are having another open house on Friday at 10, right? I want to make sure I have the time right.
Yeah.
So, if anybody wants to hop on that as well or pass along the information, you're welcome to do so. Does anyone have any other questions? You can always reach out also. I'll put the email address again, familysupport@gemmaservices.org. If you have any other questions, we'll get right back to you. Okay.
Right.
Thank you, everyone.
Thank you all for
Stay
coming.
dry. All right. Bye-bye.
Bye.
Bye, thank you.
Thank you.